Coronavirus cases in Nigeria rise to 1,932, with 204 new cases confirmed by the NCDC.
Presidential Task Force on COVID-19 appeals for personal and collective responsibility when lockdown is lifted.
No one should mistake the easing of restrictions for permission to act without care.
President Buhari directs armed forces to sustain onslaught against Boko Haram menace.
On Good Morning Nigeria today, we shall discuss COVID-19 and the Nigerian workforce.
All right, International Workers' Day, also known as May or Labour's Day in some countries, and of course here at home it's called May Day. It's a celebration of the working class. Now the day is of course flagged off by the International Labour Movement and is observed every year on the 1st of May. That's today.
All right, you're right, Claire. In Nigeria, May Day is usually a public holiday, and today it's also been declared a public holiday. And on such an occasion, workers converge to listen to the president of the Nigerian Labour Congress, the TUC, that's the Trade Union Congress, and other leaders as they address their members on the welfare achievements of the labour unions.
All right, let me also remind you that May Day in Nigeria was first declared as public holiday in 1980. And of course, it became a national holiday on the 1st of May, 1981. That's precisely about 39 years ago.
But sadly, this year, the age-long tradition of march past, comradeship, speeches, and physical solidarity, usually associated with the Workers' Day celebration, will be missing. And certainly you know why this is happening, Claire.
Well, of course, Kingsley, you and I know what's happening, and that's because of the COVID-19, you know, which is affecting so many things. And as we, you know, want to say, you know, it's introducing what we call new normal since after the confirmation of the index case in Lagos, about February 27 this year. Now, a circular from the head of the Civil Service of the Federation had directed all non-essential public servants on grade levels 12 and below to stay at home, and that's compulsorily from March the 24th as a way of containing the spread of the virus. And of course, Kester, you know that the lockdown and the social distancing, you know, has made it impossible for traditional march past and all the, you know, platforms to express labor workers' struggles.
Yeah, the usual aluta and all of that, no question about that. But of course, the directive for certain categories of workers to stay at home was first issued by the Lagos state government. And then subsequently, President Muhammadu Buhari ordered a lockdown of the Federal Capital Territory, Lagos and Ogun states, with effect from the 30th of March. And this, of course, coupled with other governments announcing lockdowns in their various states. The Nigerian workforce has, as it were, almost completely shut down activities for well over 5 weeks now. But with the forthcoming relaxation of the lockdown, civil servants from grade level 14 and above have been directed at the federal level to resume work partially from Monday, the 4th of May, and work 3 times a week. That is on Mondays, Wednesdays, and Fridays, and they're to close at 2 p.m.
All right, Kingsley, there are so many questions that the COVID-19 pandemic, you know, has raised, specifically with, you know, workers and their struggles, and of course, workers' welfare. Again, the question of, you know, justice, welfare, you know, salaries have come out, you know, have been thrown up as a result of the measures that COVID-19 have aggravated. But of course, another major question that, you know, would arise from all of this is the issue of unemployment. And there are fears that this might rise. So by how much will unemployment figures in Nigeria rise? And how safe is it to also resume work now? What preventive measures have been put in place to protect the workforce? That's about the you want to say something?
Yeah, that's right. I mean, but certainly, apart from the shutdown of formal work in offices, particularly in the public sector, we must also admit that we have seen the rise of virtual work. You know, people have had to work from home, and indeed it was a topic that we took on Good Morning Nigeria a couple of weeks ago. So the fact that there's been a lockdown, the fact that there is also social distancing hasn't meant completely that workers have not been at work. And those pertinent issues that you have raised are also important. We have seen the economic impact of COVID-19 worldwide. A number of businesses have been heavily impacted. Transportation, for instance, aviation sector is one. So you have all of that. Hospitality industry, because there's no coexistence between COVID-19 and the hospitality industry. I mean, I'm sure hotels these days are having probably, let me not make a guess, probably 10 or less % of their usual occupancy rate. So what is the impact of all of this? And if the world, and indeed Nigeria, will begin to climb out of the COVID-19 pandemic, how will all of this impact on the workers?
You talked about having virtual conversations and work. Indeed, I thought I learned that the workers will probably be having a virtual conversation, at the global level today.
Well, they should have, obviously. That would be on the basis of the various leadership of of the workers' federations. Having a conversation on the future of labor, against the background of the coronavirus pandemic.
All right.
It's on that note, we'd like to welcome you to today's edition of Good Morning Nigeria, reaching you as always live on the network service of the Nigerian Television Authority. I'm Kingsley Osadolo.
And I'm Claire Adilabo Abdul Razak. Of course, in the course of the program, Baya Tobe will be here to do the usual review of the newspapers, but not before business news. And if time permits us, we'll just peep into, the world of sports and probably look into other complementary segments of the program. But right now, let's begin with highlights of the morning news. And Musbah then will have this here with us. Hello, Musbah.
Hello, Claire. Let's tell you the news. The Nigeria Center for Disease Control, NCDC, has announced 204 new cases of COVID-19 in Nigeria, increasing the total number of confirmed cases to 1,932 till date. Of the 204 new cases, 80 are in Kano, 45 in Lagos, 12 in Gombe, 9 each in Bauchi and Sokoto, 7 each in Borno and Edo. Rivers and Ogun have 6 cases each, 4 each in FCT and Akwa Ibom State. Lagos State now has a total of 976 cases, followed by Kano with 219, while FCT has 178 cases confirmed. 319 patients have been discharged, with 58 deaths recorded so far. The Presidential Task Force on COVID-19 says the decision to relax the lockdown on Lagos and Ogun States, as well as the FCT, was to maintain a balance between the health and wealth of the nation while managing the pandemic. Chairman of the task force, Boss Mustafa, reiterated appeals for personal and collective responsibility among Nigerians at the daily briefing.
No one should mistake the easing of restrictions for permission to act without care. The security agents have been instructed to respect the rights of citizens while also ensuring strict enforcement.
There are not so many people in the health sector who are infected. The latest figures we have is that there are about 113 actually, and these 113 are not all public health workers. There are some for a good number from private hospitals. And if you hear us speaking here frequently against trying to treat coronavirus in private clinics, we're actually referring to people who do so without having necessary precautions, without having necessary training.
And my responsibility is to make sure that every result we give people and say, yes, you have this disease, you have a highest likelihood that you do have it.
The Nigeria's Governors Forum is developing robust partnership with the Nigerian Police Force and the leadership of the National Union of Road Transport Workers in the enforcement of interstate lockdown as a measure to contain the spread of coronavirus pandemic. This formed part of a communique at the end of the forum's 7th teleconference. COVID-19 has advanced from the phase of importation into the country to the phase of community spread, and this has influenced a change in response strategy. According to the National Primary Healthcare Development Agency, is set to train over 200,000 members of its workforce on preparedness and response.
It is commendable that the National Primary Healthcare Development Agency and development partners have come up with a comprehensive PHC guide and training plan to provide the strategic direction required to reduce the effect of community transmission.
Our traditional leaders were very, very central to our polio eradication efforts. They were very central to Ebola outbreak response efforts. So we're using the same template to try and get to the communities.
Kano State lockdown mobile courts, which were inaugurated on Tuesday and spread across 11 strategic locations in the metropolis, have so far arrested and prosecuted 158 violators. About 63 inmates of a correctional center with minor offences have also been pardoned as part of measures to stem spread of COVID-19 in the state.
These two trucks, we search all the trucks, the two trucks, there is a lot of alcohol. And the decision that we are going to take is that the two drivers and the conductor, they are before the magistrate court here taking the fine. We are going to fine them. After that, we are going to think to give them the brooms to sweep this road or to sweep any mosques nearby or police station.
President Muhammadu Buhari has directed the nation's armed forces to sustain ongoing counter-insurgency operations on the fringes of Lake Chad and the entire northeast so that the Boko Haram menace can be totally eliminated. The president gave a directive after receiving Governor Maimala Buni of Yobe State in the State House. The governor, who briefed the president on the security situation in his state, formally appreciated the federal government for the decisive and proactive measures being employed in the renewed onslaught against the Boko Haram terrorists. Governor Buni informed the president that if the tempo is maintained, Boko Haram will soon become history. President Muhammadu Buhari, who noted with satisfaction the giant strides being recorded by the armed forces in the fight against insurgency, urged them not to relent in the discharge of their mandate. The Economic Sustainability Committee, led by Vice President Professor Yemi Osinbajo, this Thursday met with the Presidential Economic Advisory Council. The meeting via video conferencing was to rub minds on the action plan being prepared by the Economic Sustainability Committee, aimed at helping the economy bounce back after the disruption by COVID-19.
And we can just assure Nigerians that the president's vision of turning what is clearly a challenging situation into opportunities for Nigeria, that vision is in progress, and very soon the vice president will be completing the work, and the report will be sent to the president for approval and action.
And following the directive for gradual easing out of lockdown occasioned by COVID-19, head of the Civil Service of the Federation, Folashade Yemieson, has directed officers on essential services and others on grade level 14 and above to resume work with effective from Monday, 4th May 2020 in the first instance. Offices are to open only 3 times a week, Mondays, Wednesdays and Fridays and close at 2 p.m. on each day. The statement adds that upon resuming, the concerned officers are to ensure full compliance with the advisory on the COVID-19 pandemic. Permanent secretaries and chief executive officers are to ensure that hand washing and sanitary facilities are placed at entrances and strategic points in their ministries, departments and agencies. And those are the news highlights for now. Good Morning Nigeria will continue with Claire and Kingsley after this break. Good morning.
Hello everyone, hope you are keeping safe by washing your hands with soap or using sanitizer. Stay at home, it's the responsible thing to do, and whilst you're at it, you can do anything to keep your body and your mind together. Grow a beard like me if you want to, but please, let's stay at home. It's the responsible thing to do.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
The main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network. In this time of despair, our country, Nigeria, needs us now more than ever. We stand a chance to save our great country, Nigeria. A chance to rise up from this pandemic stronger and better. What will be the gain if we do not learn from other countries and observe the lockdown to stop the further spread of the virus? If we loosen our guards and allow this virus doom our very existence, then what have we gained? This is the call to every Nigerian to unite as one and stop the spread of this deadly virus. Stay at home and stay safe. Remember, the virus doesn't move unless we move. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is Good Morning Nigeria on the NTA Network service. Time to join Kunle Adeye for some business news.
The increasing number of coronavirus cases in the country compelled the federal government to lock down the FCT, Lagos and Ogun states as a measure to contain the pandemic. In the latest presidential broadcast, President Muhammadu Buhari, who acknowledged that larger percent of Nigeria's population depend on daily wages, indicated that the federal government will ease the lockdown beginning from Monday, May 4, 2020. An economist, Professor Jonathan Aremu, said steps taken by government to contain the virus is in the interest of the nation. He, however, advised that easing the lockdown should be under close watch.
We had the announcement of the president that they want to ease out the lockdown, so I'm aware of it. There may be a need to be able to revisit the lockdown so that some economic activity can take place. But the real issue is, how can we manage it if we actually say that we are going to actually say that the lockdown is no more?
And the equities market on Thursday, being the last day in April 2020, closed on a positive note as Nigeria Stock Exchange All-Share Index appreciated by plus 0.62% to close at 22,868.40 points as against plus 0.49% appreciation recorded previously. With business news, I'm Kunle Adeyeye.
Many thanks, Kunle Adeyeye, for the business package. Next is newspaper review.
Let's quickly introduce or welcome Bayo Atebe, who is already here in the studio. Bayo, good to see you again.
Good to see you, Claire. Good morning. Good morning, Kingsley. Good morning, Nigeria.
Right, Bayo, good to see you.
Thank you.
Okay, let's begin with the leadership. Leadership front page. Below the nameplate says INEC meets on Edo, Ondo, Bayelsa, and Plateau polls next week. That's on page 25. Stock market ends April with 896 billion naira gain. The stock market ends April with 896 billion naira gain. That's page 13. President Muhammadu Buhari extends tenure of NDDC Interim Management Committee, page 2. Lead story says with the kicker, May Day, merger and scrapping of MDAs won't affect jobs. That's attributed to the federal government, with a number of riders that headline that says mandates, that's federal government now, mandating SGF and head of service to implement Oronsaye's report. We are still studying report, says NLC. Will amend anti-labor laws, that's according to the Senate, and labor marks Workers' Day without fanfare in 40 years. 2020 May Day, most precarious. That's according to Isaramu. And federal government approves partial resumption of work for senior civil servants. And you come down there to the bottom half of the front page. Federal government and governors tackle rising COVID-19 cases in Kano, Gombe, and others, as 4 northern states record 363 cases. And right at the foot of the front page, 2 killed, others trapped as 8-story building collapses in Imo. Kaduna Community cries to El-Rufai over failed 250 million naira project. And CBN disburses COVID-19 intervention fund to 3,256 beneficiaries. Good.
All right, let's turn our attention now to the Daily Sun. The Daily Sun has its lead story captioned, COVID-19 bed space crisis hits Lagos. And it has some riders there. We've run out of space, says NCDC. Kanu overtakes FCT in cases, and 113 doctors test positive. The details of that story you can find on page 28. And there's a picture story And that picture story speaks to health personnel making use of COBAS system at the Nigeria Center for Disease Control National Reference Laboratory for COVID-19 testing. Now, this system, according to this paper, using this system, approximately 960 samples can be tested in 8 hours. Okay, so you see the health workers there. Trending stories just beneath that picture story. FG directs grade level 14 essential duties workers to resume Monday. And the writer says governors, police, NURTW partner to halt interstate movement. Now, Workers' Day, NECA seeks support for informal sector. Details of that on pages 2 and 8. Now, EU delegation distributes food items to more than 2,100 households in LCT. And of course, there's a writer there, Archbishop Kaigama, harps on equity in sharing palliatives. Bauchi governor approves use of chloroquine for COVID-19 treatment. Details of that on page 28. And there's a story trending just a little below the nameplate. If we can just go a bit below the nameplate, you'll find man who rejected son for breaking lockdown order lands fire means job. Details of that is on page 28. I'm sure we all saw that. Bayo and Kingsley all saw that video trending.
Yes, it was very sensational. His son was in Lagos. He called the father. He was coming. The father told him, no, don't come. And he took this initiative and came. The father first wondered how he got to Ekiti. And when he got there to the people, he said, okay, your son is here. He said, no, he's not following me home. If he has to follow me, he has to stay with you 14 days. In quarantine, after you certify him okay before he will come. Yeah, and I think that is what has impressed.
I had mixed feelings until I learned his reasons, from that video. Of course, his temperature was quite normal.
Yes.
Quite normal. So, and he was asked to take his son home. He said, no, because I don't have extra room to
isolate him.
Yeah, in any case, the son had behaved in breach of the lockdown rules, more particularly the closure of interstate boundaries. There's no, so how then did he get from Lagos to Ekiti? He said he went to Abeokuta. From Abeokuta, he sneaked. I praise the father.
I admire him.
The father, every father, should applaud what he did because it was firm. There was no point in saying, "Oh, this is my child. I will take you in." You don't know what he's coming with. This is it's not. What coronavirus has done has been to raise, our suspicion level, and sometimes it can get to the level of paranoia, by the way. But if you had told your son, say, look, stay where you are in the meantime, or if you are coming, be sure that you'll be in quarantine for 2 weeks, fair enough, because you don't know the state of health of those at home whom you are coming to meet, and nobody knows your state of health.
I learned it in secondary school from one. Our teacher used to tell us, FD, follow directions.
That's right.
So he failed to follow his father's direction. Anyway, coming to COVID-19, yesterday we had 204 new cases, and 80 of them came from Kano. Kano has now surpassed Lagos. Lagos had 45 cases. There were 12 in Gombe. Bauchi and Sokoto had about 9 each. The worrying now thing is that NCDC indicated as at close to midnight that we had 1,932 cases. 319 of them have been discharged, leaving us with 1,613 as active cases. Our death rate has increased to 58. COVID-19 test has resumed in Kano, and within a matter of 2 days, Kano has registered 118, 38 on Wednesday, 80 on Thursday. It now has a total of 219 cases. Kano has 3 deaths already. This is aside from the mysterious death for which a federal government delegation and Kano state health officials are still investigating. The presidential task force says that government is committed to curbing the spread in Kano, and the city has the same demographics like Lagos, therefore it is being given the critical attention. The area of concern now is that in Kano, the task force says 2 patients who actually absconded from the isolation center, they are going to publish their photograph. Dr. Tijani Husseini says that this is to ensure that these identified persons are located. Also in Edo State, a nursing mother who tested patient and has a baby who was already coughing has also melted away. The governor of the state identified the patient as Madam Amaka Okoro of number 2 Atoyi Idobi Street, Benin City. The essence is to help identify her and ensure that she is brought back into quarantine to ensure that she doesn't become an object of infection around. The President of the United States is that consistency in testing, higher level of testing in the United States is accounting for the higher number of test positive that they have. His argument is that most countries are not testing as many as United States, and that is why their numbers are less. Nigeria has tested so far about 10,000, and we have had about 1,932 as the positive cases, and that is about.
I think the number is, from what we read, it's a bit higher than 10,000.
10,000, okay.
Yes, I think it's about more than 12,000.
Okay.
Yes,
okay.
So,
well, yeah, not just the numbers. Every country has to worry about its own citizens and worry about its own population. The U.S. president can say that at this time it's not bringing any WHO to tongue lash them, for whatever is happening in the United States. But what about the fatalities? How do you explain those fatalities in the United States? So these are the issues. I mean, if various countries are taking preventive measures, at the outset, I'm sure this would have been minimized considerably. So each country has to take its own responsibility, I believe.
Yeah, talking about fatalities, the fatality in the United States is about 63,006, and that is about 5.9% of the total number of identified cases.
Okay,
the world over, the percentage is about 7.2. In Nigeria, we have had about 1,932 cases, and the percentage of the 58 is just about 2.7%. But the death of every single Nigerian is very important. 58 citizens that we have lost is very critical, and we need to worry about.
Claire, before we take the editorial, Kano had always been on the radar. More so now that we are seeing the growth in the number of cases in Kano. I think that it's important for not just the neighboring states, but also for those who are managing the COVID-19 in Kano, and more particularly the Presidential Task Force, to ensure that the lockdown on Kano is truly effective. An articulated truck, what we normally refer to as a trailer, was apprehended. And inside the truck, you had livestock, so the truck had the right to move. But on the truck, along with the livestock, you also had human beings and their motorcycles that were being smuggled from Kano to Kaduna.
Yes.
And Kaduna has had a fairly rigorous regime for dealing with this COVID-19. So how many persons would have slithered through the security network, and then they get into the population, mix with the population, and then the rate of infection continues?
How does that relate with the Almajiri, the evacuation of Almajiris to different, because that's what this editorial from the Punch is speaking. Yes, is writing.
There's also concern about that. I'm sure you knew 5 of the Almajiris who were repatriated from Kano to Kaduna
tested
positive, so they went into quarantine. But we're talking about the repatriation of Almajiri is formal in a sense. They say, look, we are moving these persons. They are identified. They are numbered. Take them to Katsina. Take them to Gombe. We're talking about human smuggling. To say under the pretext of transporting livestock or food or other items, people are getting into trucks, articulated trucks, and they're sneaking into the population.
So this editorial is raising some concern. Is asking for some cautious efforts. I mean for caution. It says that such system failed in the past, and of course cited an example in Kano in 2012 where such an effort, also failed. So it's like the paper is saying, look, while this is good, let's also be cautious of what we're doing.
Well, what the editorial is saying is that, well, like Kingsley pointed out, in the case of the Almajiri, wherever they are being deported from one state to the other, they are accompanied by security, and there is officials of the receiving state for which they are handed over to. But the one he pointed out, people are smuggled through trucks that are allowed passage because they are conveying foodstuffs. And somehow there is a complicity because they pass through several checkpoints. How are they able to pass up till they were apprehended? And that is why the Inspector General of Police has also instituted a special task force to check all those kind malpractices that are leading to all those. But the editorial is happening on the fact that these are broken children. They need to be helped. Many of them are orphans. Yes, orphans. They should be taken to orphanages and helped.
I think the message, editorial message is quite clear, Bayo. Yes, and that's why I think Kingsley will just appreciate you as always.
Thank you.
Thank you, and wish you safe,
restful weekend.
Restful weekend.
Thank you.
And please do stay safe. All right, that's a newspaper review for today. Let's quickly take a short break. We'll be right back.
Coronavirus, also known as COVID-19, is spreading at an alarming rate all over the globe, including Nigeria. With the number of infected persons in Nigeria increasing daily, prevention is better than cure. Coronavirus has no cure. The virus spreads from one person, who affects two persons, and by the time the affected person is isolated, the two persons have affected four, and it keeps spreading. You must take preventive measures to save yourself and that of the people around you. Always wash your hands with soap and water. Put distance between yourself and others. Whenever you cough or sneeze, cover your mouth. Clean and disinfect surfaces. Stay at home if you're sick and contact the proper authorities. Together, we can cut down the spread of the coronavirus. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest TV network.
Welcome, dear. Have you washed your hands?
Inside my house again. This thing not the key black man.
I don't know if it's misinformation or poor hygiene that will kill you first. Coronavirus is real, and good hygiene practice will save your life. Oh. Anyway, no hand washing, no eating.
I will not take care of it. How's one of the parents? Coronavirus is real and it's on the rise. But you can help yourself and help others to be safe. Remember, we can stop the spread. It's in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Do you not know that our enemies have no face? They are indigents of no state. They come from no place. And if this boat capsizes, every one of us will go under. So when the drums sound, let everybody answer. Do not say, I am the Iroko when the forest is burning. Do not say, I am the Obeche when the forest is burning. Our differences will not stop us from perishing together. So when the drums sound, let everybody answer.
The month of Ramadan is here again, and we at Al Habibiyah Islamic Society once again call on all faithful to observe the physical and social distancing directive of the government to curb the spread of COVID-19. Always wash your hands with soap and water, use hand sanitizers and face masks when necessary, and stay at home. Observe your obligatory salat, tarawih, tahajjud, du'as, and askars with your families from the comfort of your home. Stay at home, stay safe, stop the spread of COVID-19. This message is from Al Habibiyah Islamic Society, from Allah to you, a light.
I just don't understand this coronavirus thing. Is it real?
See, coronavirus, known as COVID-19, it's a global problem and has killed thousands of people in China, Italy, Spain, UK, US, and other countries around the world.
Okay. Now, why are they saying that we should stay home?
Because if you go outside and get in contact with someone who is infected, you become infected and then come back home, affect your family. That's how it happens in other countries.
Now, please, help me explain what this social distance is all about.
See, as we are now, the virus travels through the air and by touch. We must maintain 6-foot distance at all times.
Oh, so it's not by washing my hands with soap and water or hand sanitizer that is only important?
Washing of our hands regularly is very important. But we must come together and fight this virus like we did Ebola. It is our responsibility to each other.
You're watching Good Morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. As we indicated earlier, our conversation this morning is on COVID-19 and the Nigerian workforce. To set a tone for our conversation, let's now join our correspondent, Victor Azu, for a backgrounder.
That was May Day celebration for 2019, a reminder of what could have been.
Here comes the Fruits Union, the National Union of Fruits, Beverages.
The age-long tradition of March past, comradeship and physical solidarity, usually associated with the Workers' Day celebration, will all be missing thanks to COVID-19. Following the outbreak of the coronavirus pandemic in Nigeria, a circular from the head of the Civil Service of the Federation directed all non-essential public servants on grade levels 12 and below to stay at home compulsorily from March 24, 2020. With the federal government's directive for lockdown of the FCT, Lagos and Ogun states from March 30th, the Nigerian workforce shut down almost completely. The lockdown, which was also implemented to varying degrees by state governments, meant that some workers were denied pay for the period and some others lost their jobs. While some workers on the front lines of the COVID-19 response, particularly health workers, got special allowances, some others, like the media, continue to hope for a similar attention. As workers gradually get set to resume their schedules when the lockdown is eased beginning Monday, 4th May, some of the questions that will be on their minds include: how safe is it to resume work now? What preventive measures have been put in place for the workforce? What will happen to those who lost their jobs? What are the plans to reward other workers outside the health unions who made sacrifices during the lockdown period and continue to sacrifice? Our guests are already standing by to provide answers.
All right, just before they provide the answers, I need to introduce them. And of course, they are right here in the studio and from our studios outside. Let me quickly introduce Dr. Chris Ngige, who is the Minister of Labor and Employment. Honorable Minister, thank you for joining us.
Good morning.
We also have with us here Comrade Ayuba Waba, President, Nigerian Labour Congress, NLC. Comrade Waba, thank you very much for joining us.
Good morning and compliment of the Workers' Day 2020.
And Kingsley, you want to take that?
Yeah, well, joining us from our Kaduna Network Center, regular guest on Good Morning Nigeria, Comrade Issa Remo, who is General Secretary, National Union of Textile, Garment and Tailoring Workers of Nigeria, and also Vice President, Industrial All Global Union. Comrade, pleasure to have you with us on this unusual May Day.
Yes, the frontline comrades, Kingsley and Claire, happy May Day. And let me also say happy May Day to my president, Comrade Ayuba, and Comrade Honorable Minister.
And then joining us via Skype for this conversation from Lagos is Oyinkan Olasonye, who is Deputy President, Trade Union Congress of Nigeria. That's TUC. Deputy President Oyinkan Olasonye, a pleasure to have you with us. And happy Workers' Day.
Workers' Day to all Nigerian workers.
Okay, so let's begin the conversation with the Honorable Minister of Labour and Employment, Dr. Chris Ngige. Certainly, 2020 May Day is most unusual, as the year has been for humanity.
Yeah.
But what is the special significance of today under the coronavirus pandemic?
Well, Kingsley and viewers, I think it's a special May Day. I don't think in the last 40 years we've had a May Day like this, where we are all chased indoors by an invisible enemy, a virus called corona that inflicted a pathogenic disease condition that even medical science and researchers have not been able to actually classify very well. Not to talk about having the treatment, you know. So it is a May Day of fear of the unknown. Nobody knows who will contact the disease. And of course, a particular group of workers are more exposed than others. And these are the health workers. And when you come into the band of health workers, you break them down. You have the health professionals, and then you have the others who are doing health work. The professionals, you talk about the doctors, you talk about the pharmacists, you talk about the nurses, you talk about the technologists who are in the lab with all these things. You talk also about those in accident and emergency, attendants, porters, carrying people on wheelchair, issuing cards. And these are the first port of call at the consulting clinics down there. And so you look at the whole situation, and it doesn't call for cheers. But as workers, we also have to celebrate Workers' Day. We have to give thanks to God that we are still alive. We are giving thanks to God that we are still keeping the economy going. We are keeping our country running. The workers are the engine hub of every economy and every enterprise. And again, today, it also gives us time for reflection. How about the enterprises? How about the enterprises, the employers? There's public sector, there's private sector. Who is most hard hit? Both. Government has shut down government for about 6 weeks now. And no government business is going on. You are working at home. Working from home is not the same thing as working in your office. No, you can never be the same. Can never be the same. There are home distractions and things like that where you work from home. And how about the people that have closed down their industries? Can they work from home in production, in manufacturing, and the rest of them? The banks were told to work. The workers were afraid in Abuja and Lagos. They refused to appear. We got the exemption for them. Financial institutions exemption. But even today, this week they claim they are working one branch in every town. The whole of Zenith in Abuja, one branch. The whole of UB, one. So you see that there's really kind of trouble. But it needs dexterity for us to fashion a way to move on and watch what is going on in the trend of this disease. Vaccines are being developed. The Oxford group in the United Kingdom says that they are testing their own June and that they are hopeful. The American groups, I heard my colleague in America, the disease control specialist, say that they're looking up to January. And until we get vaccines, nobody's very going to be sure. I'm talking this now as a medical doctor of what the prognosis of this disease condition will be, the fatality, and morbidity. You can't really predict. You can't predict. Look at Kano, that just erupted. And you can see the deaths rolling in. And only God knows where we are going to be with Kano because of the cultural nuances of the people and things. So my take is that today, Nigerian workers also should reflect and know how we'll go. Jobs will be threatened, definitely. And African ministers, we met on Zoom meeting 2 days ago, and I'm happy that it was the same thing we were talking about in Nigeria. Health first, for people to be alive, before you talk about economy. Second is economy, job retention. Preserve the ones we have. And then make efforts to create more, because that is the only way you can do the netting out that will occur. If you create more, and there are people that must actually reduce their workforce, you balance up with the new ones you're creating, so that those people can enter new employment, whether it's ad hoc for a time. That's why in the Economic Sustenance Committee, we're looking at a band of between 6 and 12 months for the post-COVID interventions that we are doing, so that the economy doesn't suffer much. Well, you must have employers. If you don't have employer, you don't have an employee. That is the thing.
Okay, Honourable Minister, we all know that this is an unusual situation.
Yes.
You know, the COVID-19 pandemic has affected almost everything.
Yes.
You know, events are cancelled and all that, but specific to workers on a day like this, what is your evaluation of how COVID-19 has impacted on Nigerian workers?
It has impacted negatively.
In what ways? In what ways? You've talked about job loss now. In what other ways do you think, you know, from your own perspective?
Look, when you talk about Nigerian workers, like I said, there's public sector workers and private sector workers. In the public sector, you have those people who are public servants, those who are in government. Government has assured that one must pay their salaries. That is a very magnanimous pronouncement by Mr. President. He gave us marching orders that under no condition we must pay salaries and wages of these people. So for those in the public service of the federal government, a lot kind of being assured of their wages. The states, in the subnational government, we have our fears there. We have our fears. You know, we have done the minimum wage with the consequential adjustment, and the states were still battling before this situation came. I don't know what will happen in the states. The federal government has tried to bail out. Even the federation account, we have to go and take money from Sovereign Wealth Fund and SS Crude and other ones to see what we can do and pay, so that they can get their March allocation. April allocation, oil has gone down. Oil is like zero in terms of bringing revenue. We don't know what will happen there with the state governments and local governments. That's a tier of government. You go to the private sector. 80% of private sector workers are in the informal sector. By informal sector, we mean those who see trading on their own, they're buying and selling things. You get those who do daily work, or what you can call pay as you work. That the daily paid workers. Go to the motor parks, members of the transport union that are there, they are giving their commission on a daily basis. You go outside, even the artisans and things, they are paid on a daily basis. They are affected very drastically because they are not working. That is why you saw the hue and cry over the palliative distribution, because they were not in the net earlier. The net earlier was for the vulnerables in the communities. Those people know that cannot fend for themselves, the disabled, and the very poor. So now we created another group of people who are temporarily not being able to feed. They didn't have their what do you call it? They didn't have savings. When they talk about those who have bank accounts of 5,000, So these people are not able to save 5,000 and go and put in the bank. They go on daily pay work. Sometimes they earn 5,000 in a day. They come back, use it for their family to buy food and the rest of them. The next day, they go out, they are not employed. They don't have the manual job to do and things like that. So they are vulnerable. There is a little problem. There is problem, not even a little problem. There is really problem. So it is in consonance with this, the government, president said, expand the register, the cash register, by 1 million households. And each household has an average of 5%. So that's another 5 million people. Previously, the register had about 2.6 million people times 5. So you now talk about getting about close to 17 million or thereabout in the net. So the workers have felt the pinch. They have felt the pinch. The employers have also felt the pinch. We will pray for them. But all we are saying is that we have to all work together. We have some pronouncement of some banks after declaring billions of profit 2 days before. They are going
to 80% of us around the world have actually witnessed this issue of disruption in production lines and also disruption in work. So clearly also is very important that we partners, social partners in Nigeria, try to find a way around the challenge, because countries are also looking inward. Yes, the problem is global, but we must think also inward to see how we protect means of livelihood, how we're able to continue to produce, and importantly is also how to keep our people safe. And therefore, it should be a two-front approach. The issue of safety, addressing the challenge of health, and we must also, as usual, celebrate this category of workers, despite the fact that some are at home. This category of workers, the frontline health workers, are there working day and night. In fact, in some cases, overtime, to make sure that all of us are safe. These are workers, and therefore we must celebrate them. We have also other essential workers, like the security agencies, like the paramilitary. All of them have been working assiduously. So this is a day that every worker around the world look onto, so that we recognize their contribution to national development, and also is a day that we canvass for their welfare. The welfare and well-being of Nigerian workers is also very paramount. So for us, nothing has changed much. The only thing that has changed is that the usual fanfare, the parade, all the other things that follows will not be there, because it's going to be low-key. But we have found means where the speech and address of all the social partners, from government to employers and us, labor, will be able to relate to our workers, and we keep them in good spirit, because we said the struggle continues despite coronavirus.
All right, thank you. Let's go over to our Kaduna Network Center, where Comrade Issa Aremu is. And Comrade Issa, I'm going to read out a particular phrase that the NLC, president, said some time ago. I'm sure he will recollect. He said, and I'm quoting him, "Labor is an essential commodity. It is one not to be taken, trampled upon, and tossed aside." Is there any element of that, in this, do we see COVID-19, aggravating that scenario?
Well, thank you, Claire, and let me also join the Honorable Minister as well as the President of NSC to bring fraternal greetings to all the working people in Nigeria and all over the world. Don't forget that I'm also the Vice President of Industrial Global Union. We have about 50 million members worldwide and about 1.5 million members in the continent of Africa. About 7 athletes of our unions are from Nigeria, from Pengasin, Electricity Workers Union, Sewun, in that order. So I want to also join you, and especially the frontline workers, which include the media workers, on the occasion of May Day. Claire, I think I share the same view of the NSC president as well as that of the minister that this is the most precarious Mayday. Let me even add more. I think the NSC president said that as much, but I also say that labor is not just a commodity. Labor is well embedded. It's human beings. Labor is human. It deserves rights like any human being. And in this case, the real greatest threat is right to life as well as right to livelihood. I think the NSC president put it better. The condition under which you are in, there's threat to life, there's threat to livelihood. And I was just checking the statistics, before I woke up this morning, I never knew that the figure had even risen up to 58 with lost lives. Those who died include our members, workers, and sadly too, health workers, nurses, medical workers, doctors. I mean, nothing could be more tragic. Again, it's worldwide. South Africa was looking at the number as much as close to 500 deaths have been reported. United States, where we started the Mayday in 1886, the number is hundreds of thousands, about 233, thousand, people have died, which include working people. So for me, this is the most precarious Mayday that we are witnessing. And it's time for sober reflection, but as it's been said, it's also the time for us to rise up. And I think we have the tools at trade unions, first to defend the rights of our members to jobs. And I'm so gratified that the Honorable Minister has set the tone, which is also consistent with the position of the President, that under the lockdown, workers will be paid, those who are formally paid. Not only that, jobs will be protected, and I'm happy the Honorable Minister has added his voice to that. And I'm also excited that part of the intervention is that even more jobs should be created now, because we need new jobs. I heard of the initiative to create 1,000 jobs in 774 local government. This is the way to go. You can't kickstart this economy without inducing demand. And demand is a function of income. Income is a function of employment. So the more jobs you create, the more people can buy, and then goods and services produced in both the public and the private sector. So it is not the time to agonize. We shouldn't give in to the virus. I saw your tape, Kingsley, the one you played before, and for me it's quite a nostalgia. It's not even under the military, which violated our right to association. Couldn't you associate? And when I watched that tape you played just last year, we were at Eagle Square celebrating Solidarity Forever. All of a sudden we're under lock and key. I have to talk to my comrade president through NTA, and thanks to NTA. Certainly, coronavirus is not a comrade. It's not labor friendly. But we need to think beyond that. We need to combat the impact of this virus. First, we must save life, which means we must obey the protocols guiding the health. And I think we need massive education of our members under this condition. Physical distancing. We need to maintain the basic hygiene. And those who are on the front line, in particular, they need protections. They need to be well motivated. They need to be well equipped with necessary protection materials. And I also I was quite excited that there's now good insurance for the frontline workers, and they have also increased their allowances due to intervention of the Wages and Salary Commission, which of course the ministry also bought into. So, as we normally see in the labor movement, we don't agonize; we get to organize, and the way we dealt with other pandemic in the past, whether it's Ebola, the HIV, and of course other precarious conditions. Don't forget that we always live under precarious conditions in the world of work. In fact, more workers also die at work, even before coronavirus. But we have the tool. The tool is to organize, mobilize our members, and this is the time for solidarity. An injury to one is an injury to all. And I think this is the time for massive enlightenment and then collaboration. This is the time for dialogue with all the social partners, because all of us are affected. This virus is class blind. It takes the worker, it takes the employers, it takes all of us. It affects productivity. I think the only way out is partnership, for us to combat the impact on lives and the impact on the livelihoods. And I am happy that Nigeria Labour Congress, TUC, and other unions, worldwide are collaborating to find a way out of this, so that even we should think of smart working now. If you can have virtual, May Day, maybe it's also the time for us to think of life must continue. And I'm happy that there's an attempt now to ease out, in which, productivity will continue, of course, with an eye on protection of lives.
Thank you very much, Comrade Issa Aremu, for your comments. Let's go over now to Lagos, where we earlier introduced Oyinkan Olasanye, who is Deputy President of the Trade Union Congress. Via Skype, is joining us for this. Let's have your own, as it were, opening salvo on May Day 2020 against the backdrop of the global pandemic of coronavirus.
Nigerian workers could not celebrate the May Day this year as we normally do. But that does not mean that the coronavirus has been able to defeat the Nigerian workers. It only means we should do it in a subtle way and be able to think of and have plan for the future, the new future of work, and also consider new economic, we would have been doing things before. This is an opportunity to look at how better we can do things. This is an opportunity to look at the effect of situations like this, health on wealth, and also on how we can do things in a different way in our various organizations. So for us as Nigerian workers, yes, today we cannot march. Today there cannot be rally, but individually in our different sectors, we are still just maintaining the social distancing on Zoom, on the various network. We are still look at what we can do best, because now the situation is not something that can be over within 1 week, 2 weeks, or 1 month. It is something that for the next 18 months, there will be issues in the labor sector. What I mean is this. Majority of Nigerians, is only few that are workers. And these workers have various dependents. So now that there is this coronavirus affecting our source of livelihood, Nigerians are not working. The daily workers are not working. Even those that their salary is being paid, they will need to extend this to other Nigerians. Yes, health is wealth, health first. But these Nigerians, what are the medical facilities that have been put in place to assist them time like this? So these are the things we are considering now. So we'll create this opportunity to look at them, see how we can gain out of this and implement better and plan better for future occurrences. Thank you.
All right, Oyinkan Olasanye, Deputy President, Trade Union Congress, joining us via Skype from Lagos. Also in Lagos, joining us via Skype, Timothy Olawale, we earlier introduced him. He's Director General, Nigeria Employers Consultative Agency, NECA. Good to have you with us and on these unusual May Day celebrations. Clay, we've been talking about, the impact of COVID-19 on workers, not just Nigerian workers, but workers globally. But give us a sense of the magnitude of the burden that COVID-19 has brought to bear on employers.
Thank you very much, Nigeria. Let me now start on the very damp place posted on me. First policy. Labor and Nigerian worker.
Well, Claire, it looks like Dr. Olawale there, he has an audio challenge. I think our engineers will try and clear that up, and once they do, we will get the employer's perspective on 2020 May Day, plus, of course, the issues around COVID-19. I don't know if our director has any indication of whether that's been cleared up. If it All right, so it's not been cleared up. So let's return to the studios.
Yes, sorry,
Yeah,
Kingsley. I wanted the Honourable Minister. You know, we kept, if you listen to Comrade Issa Aremo, he tried to expand the scope of our understanding of frontline workers. And each time we talk about frontline workers, you know, the people that come to mind, healthcare providers. Can you give us, let us understand who exactly are the frontline workers with regards to COVID-19?
Well, the issue is clear. Frontline workers are just like, this is a war. It's a war. And in a war, you have so many battles, war fronts, so to say. So the teaching hospitals and federal medical centers and all health institutions are the war fronts in every city. So that is what it is. So who are those manning the place? They are the first line of defense against the disease going in. That's the picture you have to face. Health workers, but they have backup. Just like in the army, you have infantry, those bringing food. You have the media, the Armed Forces Public Relations Department, they are doing their own work too. So the frontline workers, they work in this fight are the health workers. And when you come into the health institution, again, you subdivide. There are those in the isolation and treatment center. They are dealing with those that we know are COVID patients. So they are dealing with them 100%. This person is COVID. Nobody is coming near, but I'm there. I'm wearing all my protective equipments, and then touching the person, examining him, giving him his drugs. Then the nurse who is ICU nurse, same, with that same doctor. Then you have anesthetists, nurses usually, and some who are not nurses, they are there. They are all inside the trench, what you call that place. Then you come back. There are those in the accident and emergency and in the clinics that are not in that place, but they do the diagnosis and then sent to this center. Those other people are running risk because some patients come, they conceal their history. They only tell you they have headache and fever and cough. Travel, did you do any travel? No. Did you do any contact with any COVID person? No. But at the end of the day, that COVID was positive.
Okay, let me ask Comrade.
So there is this grading, and as you come, even what the federal government has done is to say that everybody in that hospital environment, including the administrator, accountant, and whatever who is in his office, they are facing some risk.
Comrade, do essential workers qualify as frontline?
Well, thank you very much. In the context of the fight against corona,
yes.
First you should understand that it's a public health emergency, and therefore it's majorly a health issue. There may be other supporting staff, but in this case, the frontline health workers globally, as defined, are those category of health workers that the Honorable Minister have enumerated. Because you have both preventive, curative, you have the doctors, you have the medical laboratory scientists, you have the nurses, you have even the cleaners, the porters, all of them work together to make sure that the sick is treated. In other climes, you do a lot of fumigation. All of them working together to ensure that all of us are healthy. First and foremost, they are the front line. And I think the illustration he gave is quite apt. This is what obtains everywhere in the world. Not only in Nigeria, it's everywhere in the world. This definition is very clear. But in the context of also other workers that support the process, like you mentioned, the journalists, even the paramilitary, because you see now that in the streets, the enforcement can only be done by military and the paramilitary and the police. They are also contributing. But when you say front line, it means those that are actually directly involved, and they are actually confronting the issue headlong. So this is the actually context worldwide that is so defined. And clearly speaking, I think this is the context also that Nigeria has adopted. So this is the definition, but not to actually also undermine the fact that everybody is contributing. Everybody is contributing, but we are looking at frontline. And as I speak to you, globally, you also see the number of these frontline health workers that have been affected. I've seen in other climes where even wearing of mask have actually created a scab on somebody's face. He has been wearing masks possibly for 2 months because he can't remove it because he will be at risk. Some will be in the shift. They can't go back to their homes. So clearly speaking, that's how it is actually segmented to say that these are actually the front line. And it's a definition that I think is
That's the
global
reason
in this
why
context.
I asked for this clarification. But Kingsley, I know you.
Well, we're talking about frontline workers. I mean, just an illustration. We haven't seen that here, and we do pray and hope that it doesn't occur here. I mean, there was a report of a female doctor in New York who had been on the front line in handling COVID-19 patients. Unfortunately, she committed suicide. Just on account of seeing the pressure, of absorbing the pressure, and then seeing patients just slip away into death. She took her life. She was in her late 40s. May I so rest in peace. But let's go to Comrade Isaremo, and later on I'll pop the same question to the Honourable Minister and Comrade Ayuba Waba. Comrade, okay, now, Comrade, just before I bring that question to you, now we understand that Dr. Timothy Olawale is back on the line and his audio is much better. He's Director General of NECA. These are employers. Dr. Olawale, happily, the Honourable Minister earlier spoke in support of employers because he says that employers are as hurt as workers under the COVID-19 pandemic. But this is a unique May Day. From the employer's perspective, what are your thoughts?
And thank you, Nigerians. Let me start by responding to your question directly because of this internet issue. Those are part of the things we need to live with in this dispensation. Now, the Honourable Minister mentioned specifically the case of the banks that are, in quotes, heartless with regards to their disposition to their employees. I want to say that it would be wrong for us to use the banks as benchmark for organized businesses generally. We are all in this country and we are aware of the precarious and very serious situation and inclement operating environment for employers of labor in Nigeria. And even before coronavirus dispensation, we know many businesses were basically struggling for survival. And it's now compounded by this. What you don't have, you cannot give. And as representative body of organized businesses, our position has always been to every employers of labor that you must also pay back the loyalty of your workers by carrying them along and maintaining the full complement of your workers for as long as it is practicable. And we have always told them that, look, the issue of rationalization should be the very last option that will be open to you. And many employers have been very faithful to this. And rather than vilifying them, I think what we owe them is empathy in the situation that they have found themselves. We are all aware of the palliatives and the stimulus packages that have been as of labor in other climes. These are not hidden information. Even if we cannot do that, what
all right. Dr. Lawale, are you there?
Employers of labor, like I said, what you don't, especially when you are overburdened with indebtedness and when you are getting bankrupt, the question is, do you wait until your situation is compounded more? Those that are able to continue to accommodate the full complements of their workers should continue to do so. But I also want to agree with the minister with regards to the process for either you want to disengage or you want to get into whatever understanding that will border on the relationship you have with your employees. There are processes as enshrined in our laws. For those that have approached us to say, do we pay salaries for the period of isolation or lockdown? we have said as long as there is a subsisting contract with that employee, you have the obligation to continue to pay. And that they were at home is not out of their own choosing. So we have responsibility to pay salary. Where it becomes unsustainable and you have to make a decision, there are processes. The union representatives who are representatives of the workers must be engaged in discussion. Just like you negotiated your way into conditions of services and whatever contracts you have, you can also negotiate your way out. And once there is a binding employment terms, conditions of service, employee handbook, and even as laid down in our laws, what is very important is that you cannot just unilaterally set aside those conditions. You have to engage workers' representatives, workers' union, and directly also the employee that is concerned, so that you follow the process before you can set aside that particular contract. So employers in this climate are very responsible, and those that are far and in between, like the banks that the minister has mentioned, we engage them to also look at the situation that informed whatever decisions they are about to take. And if we know that it is reckless, we'll tell them the truth and get them to do what is right. What I believe is that the situation we are now, we must all put our hands on the deck to ensure that we do not compound the national problems, the national woes. We know unemployment is a big issue, which was one of the reasons why we commend government to balance the care for life with economic sustenance. And we are happy that there is a gradual ease of the lockdown, which will also be some sort of commitment to businesses that, look, they could still salvage most of these fears that we are talking about. In other words, there might not be necessity to start saying they must take those hard decisions with regards to letting their employees go. But what I'm saying in essence is that today we have sent several communications to employers of labor with regards to what they need to do to be responsible employers and to also support the country, especially the workforce, in the situation that we all find ourselves. Those are my opening remarks. Well, we just heard that we are celebrating today and also celebrating specifically those workers that have sown their sweat into the world of work, especially those in the health sector. They are taking the brunt on behalf of every one of us. We celebrate them. We recognize what they are doing on behalf of every one of us. And the leadership of the Congress too, we also celebrate you for giving direction to the workforce. Thank you very much.
Timothy Olawale, DG NECA, quite reassuring words coming from you. Ladies and gentlemen, let's take a short break. When we come back, we'll continue with our conversation.
The Nigerian Supreme Council for Islamic Affairs, under the leadership of its President General, His Eminence, the Sultan of Sokoto, Alhaji Muhammad Saad Abubakar, CFR MNI, congratulates the Muslim Ummah on the commencement of the fasting of the month of Ramadan, beseeching Allah to grant us the blessings of the month and to inscribe us among the inhabitants of Al-Jannah. The Council has directed the suspension of congregational Taraweeh prayers, Majalis al-Tafsir, Quranic sessions, and i'tikaf seclusion in the mosques during the month of Ramadan. Islamic scholars and organizations are to employ the electronic media for dissemination of tafsir and other da'wah activities. Janaza, washing, shrouding, prayer and burial of Muslim victims are to be carried out by officials of the Nigeria Center for Disease Control, NCDC, and other government health officials. Detailed guidelines on the suspension and the janaza are available on the Council's website and are being published in national dailies and sent to the federal and state governments as well as leadership of state councils and various Islamic organizations. The Quran says, "Make not your own hands contribute to your destruction." His Eminence the Sultan praised the Almighty Allah to preserve our lives beyond the Ramadan and grant us its blessings. Mr. Yusuf Nwoha, Director Administration, Nigerian Supreme Council for Islamic Affairs, announcer.
As you can see, I'm at home. I'm reading a book. When I get bored, I watch movies. Life has not stopped. Together we can beat this thing. All we have to do is make sure we do the necessary things, which is wash our hands, use hand sanitizer frequently, wash your hands with soap. Please avoid crowded environments, crowded places. If you must head out maybe to get groceries, use the face mask. So please stay safe, stay responsible, and stay at home.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide. Don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
Wetin be this coronavirus thing? Na true?
You see this coronavirus wey be COVID-19. Na the whole world palava. And it don't they kill many people for China, Italy, UK, US, Spain, and even for other countries them.
Okay, wetin come be the reason wey dem say make everybody tanda for house?
Now because if they waka pium go carry am from person wey don't get am, you go carry come give your family them. Now so the thing take they kill other people for other countries.
Okay, wetin come be that social distancing self?
You see social distance. Now make we no come close because this thing now from air and touch now we dey contact them. We suppose dey at least 6 foot away from each other every time.
So okay, no be only to wash your hand and to sanitize them alone.
Make we no take this washing of hand thing take play but make we come together, join hand as we take pursue Ebola, pursue this coronavirus. Make we be each other keepers now.
All right, you're welcome back, and it's still Good Morning Nigeria, reaching you on the network service of the Nigerian Television Authority. Let's return to Kromodisa Aremo in our Kaduna Network Center. Kromodisa Aremo, I mean, there are a number of issues on the table with regard to the peculiarity of this year's May Day against the backdrop of COVID-19 and the medium to long-term consequences of COVID-19. Job security is one. Lawale in Lagos, speaking from the employer side, has also touched on that along with the Honorable Minister of Labour here with us in the studios. But there is the other aspect. I mean, oftentimes we reference the frontline workers in terms of safety. But obviously, to the extent that workers are wealth creators and health is wealth, it appears that some persons have argued that the issue of occupational safety and indeed ramping up our healthcare system will be one of the contentious issues that we have to grapple with post-COVID-19 pandemic. What's your reaction?
Well, thank you, Sadolo. Not just even post-COVID-19, but even now we need to grapple with that. But from the Your background comment, I think what has come out is that more than ever before, we can see that labor is an important factor, not just of production, but of development of livelihood. My primary union, which is Textile Workers Union, is an affiliate of Nigeria Labour Congress, and the NSC motto reads, labor creates wealth. But from what we have seen now in the last 2 months, you can also see that labor saves life. So labor is central when it comes to lives as well as livelihood. And that comes to the point you keep on raising about the issue of the frontline workers. I mean, can you just imagine? And I don't think we need so much debate on, who are the primary workers. I mean, it's well explained. You know that the first casualty during Ebola, Dr. Adadevo, may also rest in peace. She was the first frontline, who saved all of us from that pandemic. You also know Dr. Julius, who actually, discovered that Italian first case. So it's clear when we talk of frontline. I mean, the public health workers who move on, including private health workers. The key word is that they are the health workers who first of all deal with the patients. But as the Honorable Minister also said, it's a whole value chain. Because the health workers themselves, they need the protective, personal protective equipment. These are all produced by other workers. So those who produce sanitizers, they are so important. Those who make water available are, of course, tailors from my own union. Those who sew nose mask, the textile workers who produce the fabric. I mean, we're all part of the value chain. I think this year is the day of, today is the day of solidarity, and I think the whole challenge is to bring all the workers together. But I also agree with you that the challenge is for us to see the impact of this pandemic on jobs. That's extremely very, very critical. And I think that what this crisis has shown is that all of us are vulnerable, in the case of any crisis of this nature. Businesses are affected, labor is affected, government revenue is also affected. I listened to the Honorable Minister very well. So the same way we did so to solidarity to cope with lives and livelihood under the condition, I think that post-COVID, that's the way it should go. I don't think we should return to the old economics of winner takes all, in which some people make huge profit and workers have to struggle before they get their pay, before they get guaranteed. I think this is the time for win-win economic approach. And I'm happy the way the federal government is already going in that direction. We have a lot of stimulus plan. In fact, the central bank governor said the agenda very well to say that we can turn this tragedy to greater opportunities. And the monetary authorities has come with a number of incentives that can incentivize the private sector back. They've reduced the rate of interest. There have also been a lot of support, some loans for medium and private small enterprise to come on board. So I want NECA to also have the same approach, especially in the private sector, to sustain the jobs of workers and at the same time ensure productivity. Of course, at the federal level, I've said so before, this is even the time to have new jobs, as the case may be. We have to think ahead about the future of work, and we can see new jobs that I imagine now. If health is not a big thing, it's also an industry of its own. I mean, we need sanitary workers, those who are clean environment. We need to invest more in preventive care, and that will bring that we need to create even more jobs, so we don't need to sack. We don't need to. We've already lost ground during this lockdown. There's massive underemployment, less of productivity. So when the easing out comes, we are moving to easing out. I think we should gain the momentum to resume back to work, which means we must retain the existing jobs and possibly create more jobs. Of course, for the informal sector, I think I want to end on this note that to say that everybody is a loser when jobs are precarious and informal. I think we have to make sure as much as possible that we get our people out of poverty from per day worked kind of environment. You can see that the poorest of the poorest under this condition are those people who live from, on daily basis, about only when they go out they can survive. I think that's not the way to go. I think we have to revisit the whole idea of casualization in formal work, make sure they get formalized in a way that they have job, they have security of tenure, they have guaranteed incomes, so that whatever the shock we are going to have later, whether it's going to be health challenge, economic challenges, our people will not be able to be in the desperate situation that we are. Even to manage the protocols now is very tough. It's only for maybe those of us who are in formal sector, who are secure jobs, who can say, okay, we're at home, we are secure. But for those who survive every day, transporters, market men and women who live on daily basis without sustained guaranteed income and without future, I mean, they can't afford that luxury. And I think you see most countries that have responded very well. It shows where they have secured decent work, not where we have jobs in which the majority of workers are casuals. They live from hand to mouth on daily basis. So I want to say in summary that all the initiatives that have been in place now, I think we should sustain them. And I want to call on the Honorable Minister that all we need now is more inclusion. I think we should bring all the stakeholders, all the job initiative you are bringing to be, the stimulus plan that the VP is driving. I think it's important to put businesses, put labor, put women, put the youths, and the way we have combated the impact of this virus is the way we must also see it through, so that we don't return back to we versus them. And I think Nigeria can recover unless everybody is on board. But what has happened so far, as I said before, shows that labor is very, very critical. Because whether you like it or not, yes, other factors of production are important, but the real factor driving our recovery today are the working people. Whether they are media, they are nurses, they are doctors, and not just in Nigeria, but worldwide. I heard Boris Johnson, when he made this remark after coming out of the hospital, the first remark he made was to salute the NHS workers, in Britain, not bankers. He wasn't saluting bankers, he was saluting working people. So,
the way you're going, I'm tempted to retain you, but I know that you're in a hurry to get to somewhere. So we just want to appreciate your contribution and, of course, wish you a very pleasant but unusual May Day celebration. All right. I'd also like to hear from Comrade Uyikon, Deputy President, Trade Union, Congress of Nigeria, who is joining us via Skype in Lagos. Comrade Issa talked about social inclusion. And just to remind you, if she's with us, the DG of ILO, predicted, of course, that there might be job loss to the tune of about 1.6 billion. So I'd like to hear what you think about the stimulus package and all the other measures that government has put in place to cushion the effect of COVID-19, especially for workers. So Comrade Aremu mentioned some of them earlier on.
Thank you so much. When the government spoke about the register of poverty, they only consider the extreme. Because for a population of a country that is over 200 million, and for workers that is over 50 million, informal sector, let's say 80 million, it means that those that are at the poverty level are not the 3,000 or the 3 million that the government have in their own register. I heard the minister talking about each household having 5. So if we decide to multiply 5 by the 3,000, by the 3 million, 3.6 million in the poor people register, it has got nowhere for the number of Nigerians at the poverty level. What I'm trying to say in essence is this, that there are so many Nigerians at the poverty level that are being catered for by the workers in the formal and in the formal sector. So now when we are talking about
I do hope we reconnect with you.
Palliative.
Okay.
And even those that
No, well, look, there's a freeze there. Onyekon Olasanya, I hope that clears up. This is part of the challenge that we have with Skype connection sometimes. I just want to return to the Honorable Minister of Labour and Employment and pop the same question that I did to Issa Aremu with regard to the health aspect of workers, particularly Nigerian workers. Now, occupational safety would appear to be one area where there's been a great deal of laxity. And then the general healthcare system, because we have seen how the fragility of the system can put everyone in danger. And from your medical perspective and the fact of what you do now in cabinet, what are the essential points that we have to take along as critical lessons post-COVID-19?
Yeah, thank you, Kingsley. COVID-19 is like a coin, two sides. Bad side and good side. What is the good side? The good side is that it has exposed the health system of the world, especially for us in Nigeria, our own. We have been talking all along about our health system, basic health care, secondary health care, and tertiary health care. Today, we discovered that we are nowhere in all of these places. But particularly, more importantly, is the basic health care, which is supposed to be at the primary health care level. Because that is supposed to be the area of first contact. And these are in the local governments. Today, as we speak, we have 774 local governments. We have wards. And the target is that every ward should have a basic health care so that the people can go there. But they're not functional. The few that are functional is not even up to in the region of about 3,000 plus. Very, very, very low. Those that are also functional, we don't have doctors manning them. The Nigerian Medical Association, even people, the last course set in NIPS did a paper on this, which they presented to Mr. President. And he said that every BSc should be manned by a medical doctor, even if he's an NYSC doctor. We don't have need for NYSC doctors to be in Abuja and in the cities and Lagos and the rest of them all. They should go there. And that is what I mean at one point that I quarreled with the NMA, that we have enough to go around. That is the question of redeployment. Managing the resources we have efficiently. So today, we discovered that is not true. The health bill, the health act that is operational now, has a pool fund for basic health care. And this pool fund is to cater for health care, basic health care, emergencies, and health insurance. But the basic health care operation is supposed to take about 80% of that fund. The state governments are supposed to counter fund to the tune of 25%. Because these health care centers are in the states and local government, and that's where the people are. How many state governments have assessed? Only 8. Only 8. Everything is done federal government, federal government, federal government. President Buhari. No, that's not fair. The federal government of Nigeria is not supposed to do basic health care. But today, they are stretching and going there to do because the states have relegated their duties and their function. I was a state governor. Before I left Anambra State, I had refurbished my 21 local government general hospitals. I have done many healthcare centers, and I brought in what I call local government doctors. They moved from the local government and finance into these places. I couldn't provide them accommodation at that time. But my second stage was to put the accommodation for them to live in and stay there. So what COVID has done is to tell us, to wake us all up from our slumber. We must fight health care and do what is necessary there. It is those who are alive that you talk about their economy and their work and their food and their housing. So you must do that. It's in the front burner now. It has shown us. It has exposed our nyash according to the boys in the streets. Yes, that's what it is. And that is the truth of the matter. Secondary health care. How many governors have general hospitals functional in their places? Maybe you talk about Lagos, you talk about Delta, where Okowa is a medical doctor and realizes the importance. Lagos, their system is so good that any governor that comes, because of the abundance of resources, you must do your secondary health care and even basic health care. These are the states that are maybe, to an extent, what Peter Dili put up in Rivers, the remnants of it is still struggling and going. But all other states in Nigeria are not functional. Kaduna, again, you might put in, because private care practice in Kaduna is blossoming. There are many private doctors and private healthcare personnel there. So their private healthcare has sort of a bridge gap that you have there. So this is a wake-up call. Everybody now must sit up. We must fight health. Health is wealth. That is what it is, whether we like it or not. Health is wealth. And health workers are prized items. They are prized items. That is why I'm never happy when they say doctors and nurses have gone on strike. They are essential workers. They are essential workers. That is also why I recommended that their salaries were seized when they went on strike. And I begged them for nearly 1.5 months and they refused to go back. I said that they should see their salary. The doctors in Just Hospital and FMC Owerri. And they came to my office sprawling on the ground, oh, lift it. I said, no, I won't lift it. Those that are dead from your strike, we can wake them up. When other facet of the working group go on strike, you can make up. If teachers go on strike, like this my ASU friends, they come back, they will be teaching in the night, they will be teaching early in the morning, they will be teaching, even though it's not good. But they tell you that they're making up for the syllabus, for the program. But we can't go and wake up anybody that has died as a result of health and medical workers' strike. So they should realize that, and that's why they are put in a special compartment of commerce in the salary structure of Nigeria. Consolidated medical system scale, commerce. Consolidated health scale, CONHES. If you go there, they have preferential advantage, just near to that of the armed forces, among others. They have other allowances that are imbued there. Teaching allowance, inducement allowance, hazard allowance, which also COVID has exposed, that is nothing to write home about. And we had to immediately, as government, rush to do an enhanced hazard allowance now for them. We did an African labor ministers conference 2 days ago by Zoom from Addis Ababa, the AU Commission, moderating and the ILO, and Nigeria was praised for that. Ghana also has done. So about 10 countries have seen that their hazard allowance is nothing to go by with this situation we have on ground. Nigeria has also even done insurance.
All right, Honorable
Group
Minister.
life insurance for them. And there's insurance for accident and injuries at work, which we have also rekindled. And for the people who are in the center, isolation center, treatment center itself, but staring and looking at the COVID man with his cough and everything, we put an enhanced 20% rise to make 70% for those group of people.
Beautiful.
Rise.
Beautiful.
And we're also topping up their insurance because the Presidential Task Force have 5,000 life insurance donated. And we have made a recommendation to them that apart from the group life, which these people have gotten, apart from the ECA, Employee Compensation Act, that you must also give them a top-up from that life insurance donated by the insurance company. So we're home and dry in their protection now.
Very beautiful.
Yes.
Very beautiful for the health workers. Thank you. I just like Comrade Oyukon to conclude her thought quickly before we just take NECA's DG's final words. Comrade Oyiko, please could you respond to my question on what your evaluation of the stimulus plan? Very briefly, please. Comrade Oyiko, are you with us? Yes, can you conclude your thoughts on what you think about the stimulus plan of the federal government?
Thank you so much. I'll first start by saying that most of the time that Nigerian workers have been on strike, it is in order to ask for better working conditions and working tools. So, and each time we ask for palliatives in Nigeria, it is for things that are essentials. So if the federal government can make sure that Nigerian workers have free access to good and medical facilities, that because we don't have the means of traveling out of the country before we can provide for our health. And you see that majority of the people that are being affected to the point of death on this COVID-19 are people that have underlying ailments. So we want to appeal that the palliative, the first one we want to appeal for is that there should be proper medical facilities in the country. Then if we have enough medical facilities, then that one will be settled. Then we'll now ask, yes, salaries are being paid for federal government workers, but I want to also appeal to the Minister of Labor. He has said so many beautiful things today, that the Nigerian labor law has not been as effective to handle most of these employers in the private sector. So we should also look into this.
All right, I think we, Comrade Oyiko, thank you. The Honourable Minister has, of course, heard all your appeals there. We don't have much time with us. Let's bring in the DG NECA. DG NECA, your final words, briefly, just before we round off our conversation.
Let me briefly speak about the issue of health watch post-lockdown and post-COVID. It is very important because we have just one life. And once it is compromised or lost, there is but nothing you can do. So responsibility for safety and health is for everybody, not just the health workers. And we have to separate what we have control over and what we don't have control over. For what are government rules, these you may not have control over, other than to be seen to offer advices to government on what you feel is right and what should government be doing with regards to all those health and safety matters.
All right, Dr. Olawale, thank you very much. Very briefly, Comrade Ayuba Waba. Look, yeah, we've said so. I mean, you as guests, you've said so many very nice things, and also expressed a great deal of wishes. But some persons would say, in the worst-case scenario, that you have a lot of battles ahead, particularly with regard to job security. If the global economy slips into not just recession but depression, you have a lot of work on your hands. What is it that you would like to see done in the Nigerian environment?
Well, thank you very much. Let me try to correct a figure that Madam quoted about the likely jobs that are going to be lost according to recent study by ILO. ILO posited that 25 million jobs are actually at risk, and income, about 3.4 trillion income is also will be affected. In the context of all of this, clearly speaking, we are in a very challenging period. But I agree that in every challenge and in every situation, there is also a way out. Because the way out now is to rethink, one, our economy. Two, and let me try to expatiate on that. We can't continue to do things the way we used to do it. And one issue that Labour have canvassed over time is to look at how strategically we can look at options that are available to us. One, why should we continue to import everything we use in Nigeria, therefore expecting our jobs? One issue I will refer to is the issue of oil and gas. For over 30 years, we cannot refine product for our domestic use. Now in this challenging period, one, we need forex, even to import the refined product that we are going to use. So clearly speaking, we must rethink our economy. And the issue of saying that we will continue in one direction will not arise. So one, jobs will be threatened.
Okay.
And two, the issue of threat to income, means of income will also be there. But as organized labor, as Minister have said, we will not take a situation where employers, government, will use unilateral means without respecting our laws, without social dialogue, without discussion, reduce worker salary arbitrarily.
Thank you,
That
comrade.
is not expected,
Thank
and
you.
that we are not going to agree.
Honorable Minister, just
Yes.
your message. Briefly, we have less than 30 seconds.
Message is clear. This year is not same. We're in unusual times. President Muhammad Buhari has sent his felicitations to the Nigerian workers on this day, and I've transmitted the message to the labor centers saying that he's with them, he appreciates them, and more importantly, those who are in the first line, as we used to say. So I also am in solidarity with Nigerian workers, and for me, it's a luta continua, solidarity forever.
All right. On that note, we'd like to appreciate Dr. Chris Ngige, Honorable Minister of Labour and Employment, and our guest who joined us from Lagos via Skype. Olawale, thank you very much. That's of NECA. We also like to appreciate Olasonye, who is of the TUC. Comrade Ayuba Waba, thank you for being with us on the program. We also appreciate all those who sent in their tweets. The issues you raised have also been addressed by our guests. Thank you for being with us. Good Morning Nigeria returns on Monday, same time, 7 o'clock in the morning. Until then, have a lovely weekend, but stay safe as always. I'm Kingsley Osadolo.
See you next week. Bye-bye.